Batwa Development Program, a program of the Diocese of Chinchizi, which was established in the year 2008 to take care of the Batwa and help them to transform themselves.
Tukaba turabona turataha mweyamba tutine icyo kunyamaho nk'abandi ngo tunyame hamukeka nangwa tugire kuko abantu baranyama baba bari mu cyaro itwe twatunyamaga mu nda y'emigogo ebyisubiko byetu jya bibaga ibisanza amezi ebinyasi ari byo turara twamara kubyara icyo twatwisubikaga nempu ze imfumberi enkanda nizo zazibaga burangiti zetu ekikuru munonga burangiti yaba twagwagubaga uwo muriro
kuri yo twarigire tukaba turarya ifumbiri inyama za buri muringo kutwabire twarugayo amagara namwe bwambiri nobwo twabwene birungi amagara gagaruke nyuma.
Batwa Development Program is an organization for Batwa that is helping the Batwa to help themselves. And by the time they were living in the forest, they used to live in such a kind of huts. And since 2019, I'm happy to tell you that we have already constructed 43 houses in different settlements.
My name is Kellermann, Charity, aged 30 years, and I'm one of the Batwa tribe. Now I'm an assistant education officer, Batwa Development Program, and at the same time mentor to the Batwa kids. I do give guidance and counseling to the Batwa children and to their parents, so that they can at least know what is like going to school, or what is good to go to school, what is like maybe liking handouts. You know, handouts and influencing many Batwa not to achieve their goals, especially under Batwa Development Program.
It was started by Mrs. Diane Stanton when she first visited here at the invitation of the Archbishop of Uganda, the late Livingstone Nkoyoyo, who had seen the plight of these people. After sharing the need with Diana Stanton, she went and started looking for volunteers who could come and help, and especially doctors, because their health was in a very poor state. And that is how a man called Dr. Scott Kellermann and his wife Carol offered themselves to come and we work with the diocese to help in this situation.
My wife was very afraid of Africa because my subspecialty is tropical medicine, and she knew the diseases she might encounter if she came to Africa. But she agreed to come. After we'd been here about a month working with the Batwa, she turned to me and she said, "I feel like I've come home." And then after another couple of weeks, she said, "These people need our help."
So they came here and they started treating Batwa. Then they thought there was a need for a medical center or a hospital, and that is how they helped set up a hospital called Bwindi Community Hospital. Even when the hospital was established, Batwa were not fully accessing the health services BDP was offering. And so we started with a program of paying for their health insurance. It's called Equality.
Equality Health Insurance Scheme is a community-based program that was started to ensure that all people living in our catchment area can acquire quality and affordable health care irrespective of their geographical or financial means. The pygmies under our scheme are paid for by the Batwa Development Program, which pays all the premiums under insurance so that when they come to Bwindi Community Hospital, they can access all the services at a free cost, because the Batwa Development Program pays all their premiums, pays all their transport, and all other co-payments that they are supposed to pay when they come here at Bwindi Community Hospital.
Since they have started the health ministry and can heal their bodies, they also needed to be helped to know how to grow food.
We come in to help and advise them how they can use their soil to get what to eat. About 70% of these Batwa settlements are located in hilly areas, so they face soil erosion, soil exhaustion. So we train them how they can do water and soil conservation so that they can conserve their soils for proper crop yields. So in these settlements, we have 233 households, all who participate in agriculture. And what we do, we have 2 seasons in a year, and in every season, we provide for them seeds. And we continue and follow them, see how they are prepared to plant their seeds. For example, we see how they have done their primary cultivations, and then we calculate the number of the quantity of seeds to plant according to how this batwa will be prepared to plant. With the help of Batwa Development Program, we have constructed a number of goat pens in most of Batwa communities, and in the schools where we have Batwa children, we also have goat project as well.
They started a program of building houses for them. They started with mud houses with a metal roof. They lived in these houses for quite a number of years until 2019, when we realized these houses were not sustainable and they needed longer lasting houses. And now we have moved from mud houses to brick houses.
Ekitongole kyatwakiri twayikaba twombekeraga amazu twagatahamu kandi n'okuhinga batuha n'ebibyo byo kugira ngo tugume tuhinge twiheme emere turye tubeho. Ekyo ndikuhura ndakikakasa munonga kandi ndakibeshimishaho. Nabwo bambe tari mu makipangiye kugira ngo no mu makikozi ni Mukama Ruhanga yakikozi.
Education for us is the priority.
In the Batwa Development Program education, we have 3 schools, that is Mama Dana Nursery School, Nawet School Mukongoro, Jumba Place Primary School, and we also have a community primary school which we take care of, that is Shanda Community Nursery and Primary School. We give different services to both Batwa and non-Batwa children. In our schools, about 90% of our funding is the donation from the Kellermann Foundation, and 10% is local fund in the form of fees from parents. We have 1,553 children in different schools, and out of these children, 426 are Batwa children. Batwa children, we provide school fees, all school fees to them. We also provide all school supplies and food when they are at school. I also provide guidance and counseling to all Batwa and non-Batwa children.
We are very grateful for the good work being done by BDP. For now, the enrollment of the school has increased from 150 Per now, we have 450 pupils in the school, and among those pupils, we have 25 Batwa children. We had Batwa children around who could not access schools, who could not get where to study from, but fortunately enough, when we got this school in this community, it helped a lot. We now have the Batwa children in schools.
The program is growing, and we are trying to improve our own schools so that we can have a good standard. So actually our schools now are the best in this area. We believe in the near future we shall have many Batwa who are self-reliant because with these children that are in school, at the moment we have only one Mutwa who has done a master's degree, actually first and second degrees. It is only now that we have two Batwa who are doing university, and others are in secondary and other institutions like vocational schools. So we believe when those have attained a certain level, a higher level of education, and have had jobs, I believe some of them will have jobs, they will be able to be on their own.